right. Well, good
This young
morning.
lady, can I say something? This young lady right here's dad is a good friend of mine. I didn't know it till just now. Mr. Bill Rogers. And she's right at home with all this music.
I think we're going to use this one if that's okay, Louise. Okay, so good morning. I walked in and I felt right at home, so thank you for that. Like, that's such a blessing to be able just to walk in and hear the gospel and also hear some good country music, so thank you for that. And it's just, like I said, it's very sentimental to me because of my father. But hi. I'm Ashley. I'm the Vice President of Senior Care Alliance. I want to first by thank you guys for your time. Everyone's getting a green bag. And so in those green bags are all kinds of free information because we're just a nonprofit group that's called Senior Care Alliance where we come out and help seniors get accurate medical information. Also, we want to have somebody right in front of you that you can ask questions to. Who all phone is ringing like crazy right now? Changing insurances, just scam calls. People are trying to get you to do things, and we don't know who is real when they're calling us. So our mission here is to be an advocate and be able to give free education and help you where you're needing it. We're all in different seasons of life. Some of us are taking care of parents. Some of us are taking care of friends. We're all needing information at all seasons of our life. So once again, we're with Senior Care Alliance. Today in your green bag, all that good information in there, you'll also see a directory that says Senior Care Alliance. This directory is wonderful. This is something that you want to keep on your little table next to maybe your recliner, your chair, your kitchen. When you open it up, it's got a table of contents that's right here. And if you need a level of care, let's say you're needing some home health, maybe rehab, maybe hospice, maybe you're hearing these kind of words from your primary care or at a bedside at the hospital, this is a great section to use. And if you need, for example, home health, this green arrow, you're going to flip. And as you flip, you'll see green arrows, and that's home health agencies. That gives you direct contact with somebody you can call and ask questions. There's long-term care, there's memory care, there's respite care, skilled nursing. A lot of those terms, of course, we don't really know what they mean fully, but we'll help you with that. So if you have any questions, that's what we're here for. There's also a piece of paper that's loose in there. It's got a big red bar that says, "Attention 911 workers." This piece is something that we feel like is very important for everyone to slap on the refrigerator, put somewhere, maybe tape it next to your door. When a 911 responder comes to your home and you're unconscious, you can't give them information. They don't know who to call. They don't know who to contact. They don't know what meds you're on. They don't know, they don't know that you might have another, your spouse or something might be also have a significant medical history. I would fill this out and put all your information on it, put it on your fridge so they can find it. 911 medical, they're trained to look for this type of information, okay? But it's a great key to have and also to help you in an emergency. When you flip it open, that's all of our Senior Care Alliance members. These are all the companies on here. They're here to help you. So once again, we're just another advocate for you guys to help answer questions. And if I can't help you, I may work for Mercy Rehab, but I have a friend that works in skilled nursing or primary care or home health or whatever level they're in. We're going to turn you over to them if that's the help that you need. Okay, we're a community and we're working together. Okay? I would like to introduce our speaker, Mr. J. He's with Encompass Health Rehab Hospital. And he's going to give us a little brief education, and then we're going to all kind of come up and take turns introducing ourselves. We did bring you all a sweet treat back there, and just once again, thank you for your time, and God bless. Oh, one more thing, because I probably will forget in a second. Senior Appreciation Day flyer. We left a flyer with them. They're going to make copies of it for you. We have a free Senior Day coming up. So anybody's able to come, we would love to have them. From 10 to 2 on May 19th, we're going to have a free bingo day. We're going to have hot dogs, free give outs. And all of our members are going to have tables set up with goodies to give out to you guys. And we just want to love on our community, so we invite y'all and would love to see you there.
I'm not sure if I'm going to need that or not. I'm kind of loud anyway. Does everybody hear me okay? Or do you feel like
I think you need it.
I think you need
I
it.
think you need it.
We're recording.
Oh, okay, we're recording. I did not know this. I probably would have declined if I would have realized that. So, hello, my name is Jay Hudnall. I'm the Director of Therapy Operations at Encompass Health. And I'm going to give a presentation on brain injury. Being Brain Injury Recognition Month, Awareness Acknowledgement Month, I think it's a good idea for us to have this discussion. Now, what Miss Cindy, our Business Development Director, has passed out, and some of the others have helped pass out, is basically this presentation. It's a little robust. It's got a lot of information on it. I'm not going to go over every slide sentence by sentence, but we are going to hit the high points and talk a little bit about that as far as brain injury goes, okay? So the first thing I want to talk about is, everybody hear me okay? Yeah. So the objectives today is just to talk about brain injury and define specifically what it is. How do we go about in a therapeutic setting assessing and kind of grading how severe maybe a brain injury might be? What are some of those tools we use? What are some of the physical and mental and cognitive issues someone with a brain injury might see or experience? We'll talk a little bit about that and so on. Also, we'll describe the healthcare professional's role and what different people do to help someone with a brain injury, or if you have a loved one that's had a problem with that. The first thing we want to talk about regarding our more specific slides is you see a picture there of our beautiful brain broken down into different lobes and so forth. You see the colored demonstration if you flip through your guide. So a brain injury can be caused by many different things. It can be traumatic, which is kind of what some of us think of, such as we have a car wreck. Maybe we had a fall. That's something that's really big in hospitals and healthcare settings, especially our rehab settings, preventing falls with the elderly. Maybe a gunshot wound or something terrible like that. Sometimes we have a brain injury after surgery, unintentionally, something like that. Infections of the brain, and then we have a lack of oxygen. Sometimes we think about strokes and lack of oxygen as being brain injury. So it can occur in two ways. It can be injury itself, or it can be like swelling, or maybe the support system to the brain has been cut off. So there's different types of things that cause that. A little bit deeper discussion, but axonal, rotational injuries, blunt force, when someone hits you, in different areas of the brain, you see different effects, different results from what took place. Skull fracture, projectile injuries such as gunshot wound, a bruise, or maybe a hemorrhaging of a blood vessel. Those are different things that can cause a brain injury. So there's 2.8 million brain injuries each year in the United States. 214,000 of those are hospitalized, with 100,000 of them considered severe. So there were 64,000 deaths in the United States due to brain injury, with 176 of those per day. So we often think about brain injury as, it's equal opportunity. Anybody can suffer a brain injury, right? But you do see more brain injury with certain demographics. Racial minorities, maybe service members or veterans, more commonly seen. Homelessness, people that work in correction or detentional facilities, maybe those that live in rural areas. You see that as more common to suffer a brain injury. All right. falls is accounted for nearly half of our traumatic brain injury. So it's really important for us to work hard on preventing falls, especially as we get older, as we go along, and our balance and our strength is affected. Motor vehicle accidents. If you look on our pie graph on your slide, if you got that open by chance, you'll see a bar graph and a pie graph specifying the different percentages. And you see falls is about 40% of the brain injuries that we see suffered. Males, I don't know what us males are doing, but we're much more at a higher risk than our females are with regards to suffering a brain injury. All right. So what we want to do is describe now our different levels that equate to a brain injury. All right, so basically Rancho. Rancho is something that gives us a common language that we can discuss the level of someone who's had a brain injury. Think about somebody in a real early phase. There's 10 phases. The first 1, 2, 3, think about them being, basically comatose. They're kind of asleep, not the type of person you see in an inpatient rehab facility. Maybe they're on a ventilator, something of that nature. Going into level 4, we see that person starting to respond, starting to wake up a little bit, starting to be confused. You see a lot of agitation, so forth as that. So Ranchos is one of our descriptors that we're able to more specifically define what level the patient's at. Then the doctor, the nurse, the therapist can work a little bit more assiduously with you regarding what to do and what's the next step to help that individual. Everybody good? So you guys can see on your handout different levels there as we go through level 4, confused and agitated. Level 5, confused but inappropriate, non-agitated. Level 6, confused but appropriate, and so on. Okay? So we got to be really careful as we're looking at people with brain injuries and how we approach them and what's the best way to tend that person. All right? Like level 5, we're confused and we're inappropriate. They need maximum assistance. They need a lot of help to be there for them. All right? Confused, moderate assistance for level 6. Verbal expressions maybe are inappropriate. Maybe they say things off the wall that typically that person would not say, and it's outside of their character. So we're going to watch for that. And then we have, as we get higher, closer to 7, 8, 9, someone's coming around, they need less physical assistance, they need less help with their self-care and their everyday activities. They're not as agitated and just kind of on edge with things. A person with a brain injury can be very, very highly agitated to the point of aggression. They might spit, they might hit, they might shout out. And you got to think they've lost their ability at that point in time to reason, and they really don't understand what's going on. My wife has often accused me of having a brain injury because I don't listen to her, and I seem often confused about things. So she will appreciate that, I'm sure. So anyway, as they get higher, though, in that Rancho's level, those 10 levels that I'm describing here, they are less frustrated, less agitated, less angry. You don't have to reduce the stimulation quite as much that you would to someone in the earlier phases as they recover from a brain injury. One thing you like to see is, limiting that tension and bright lights and loud activities and limiting how much they have going on. So, excuse me. So some of the things that we think about with brain injury patients are physical. The weakness that you see. Maybe it's their limbs, maybe it's their legs. We have a lot of imbalance. We have to work as therapists, PTs, OTs, speech therapists, nursing on those particular things. We also, as I talked about, see the confusion, but then we also see psychosocial, being angry over what's happening, the lack of full understanding of what's happened to their injury. So I think that's important for us to think through, okay? So what are some of the things that we want to make sure we do with a brain injury patient? So we want to practice comfort, professionalism, and respect. Making sure that we give that person their individual personal space. We don't want to stimulate them too much too soon. Always warn that patient or that person before you approach them. John, I'm going to turn on the light now. May I go in your bathroom now? And so on. So they know what's going on and you don't frustrate or confuse them. Wait 10 seconds or so. Let them process what you're doing or what you're saying to them or what's going on. Try to use a calm voice, not an overly stimulated voice. Avoid sarcasm. They don't understand those types of things. Simple, one-step instruction. Okay? So we want to make sure we focus our attention. We have sustained attention to the level they can handle it, alternating attention and so forth. All right. So some of the things we want to do, as I stated, extra time allowance, triggers, things that trigger negative behavior in a brain injury patient is things like extra fatigue. Maybe they're hungry, being extra cold, not comfortable, needing a blanket. Maybe they feel anxiety and they're lonely. Maybe they're having an amount of pain that they're not able to describe to you in the moment. That you need to be able to address. Maybe they need to use the restroom. We see that agitation in our inpatient rehab facilities often where they can't communicate that need, but they truly are full of anxiety and need, because their bladder's full. We need to have them on a bladder program. Then if you think about someone with brain injury that's got some memory and mental setback, think about the loss of control of their own being, their own ability to do. So we want to keep them appropriately moving forward. All right. So do talk with them. Do address them. Establish a rapport. Be direct. Always explain your intentions for someone with a brain injury. As I said, stay calm. Avoid confrontational information. They are easy to take offense to things, which I know is not typically their nature. And to a loved one or a family member, that may be very confusing for them. You don't understand why they're acting out this way. But you notice this is not their norm. So what is the specific responsibilities of different medical people that work with brain injury programs? Pharmacy, being available to review the med. Doesn't the family, doesn't the patient, doesn't the caregiver want to know what the medications are? Being a consultant. That's your pharmacist's role. What does nursing do? Well, we talk about bladder management. We talk about making sure they're on a turning schedule, making their physical ability is such that they can't turn themselves in bed. Nobody wants a pressure injury, right? So it's that. It's making sure we're getting them their medications on time and in the right place, in the right moment. Managing catheters and trays and peg tubes and things of that nature. Physical therapy. Obviously, we think of physical therapy and their ability to walk and their gait and their balance. We don't see that being off severely with a low-stage brain injury. As they get better and better, we'll correct and adjust our treatment for that. And then occupational therapy. Occupational therapy just basically means what occupied their time before they had the brain injury, before they got sick. What were they able to do that now they're not able to do? And we want to get back to trying to teach them how to do it again in their normal capacity, back to their normal way of living, or maybe in an adaptive manner. And there's speech therapy, mental, cognitive, thinking through, thought process, being able to utilize special technology if they need to make their needs known as they progress. And then case management. Case management is always moving forward and trying to get you out the door, back to your home, back to the place you need to be. Okay? And that's a very, very short enough, very, very quick rendition and version of this brain injury presentation. I do want to say that as a resource in general, you do not have to have a 3-night stay to be an inpatient rehab. They are screened by our nurses and therapists at the bedside, whether that's at home or in the hospital, to come in. We take all types of insurances in inpatient rehabs. Encompasses does that, and our physician is the one that approves your ability to come in or not come in, okay? And that being said, I'm about to wrap it up. I'm getting the wrap it up look on the face of it. Guys, I just want to say thank y'all very much for having me out here. I appreciate the opportunity to speak, and I hope you guys enjoy your lunch. If you have any questions, please get with us. Thank you.
Thank you, Jerry. All right. Well, first off, we want to again say just thank you for your time. We're going to, all the members of Senior Care Alliance that are here today, just real quickly, they want to introduce themselves, tell you who they work for. If you have questions for that specific person, make sure you flag them down, okay? They're here to help you. So today's topic, that might not be something that you've been experienced with a brain injury, because that is something that's pretty significant. But if there's someone up here that you're dealing with something personally and would like some help with, these people are advocates for you. Let them help find you who you need to talk to right now in the season that you're in. I guess I'll start. I'm Ashley. I work with Mercy Rehab Hospital. We're another rehab. That's one thing that's really important, like Jay had touched on. Just honestly seeking help as soon as possible. If anybody's had a stroke, anybody's falling at home, weak at home, been in and out of the hospital, you don't have to wait for your doctor to put an order in. You can call a rehab hospital. You can call Encompass. You can call Mercy Rehab. You can call either one of us. We can come out and see you, talk to you over the phone. We will review it. We'll see if you have a case for rehab, okay? You don't have to be in the hospital for 3 midnights before you come. A lot of people get, confused with that, and that's why we're here to tell you truly how you can get the care that you need. You come to rehab, you get 3 hours a day of therapy. You do have to stay with us, but our mission and goal is to get you strong within 2 weeks and home. We don't want you to go to a nursing home. We don't want anyone to go to long-term care. We want you to stay right here, active in the community, up here playing music. But if you have questions, we're right here to talk to you. So definitely approach us and let us help. My phone number is 479-957-1700. I have some business cards, and I know Encompass gave you guys information as well. If you guys need anything, we're here for you, and I'm going to pass the baton.
Hi, I'm Cassie Barnes. I'm from the Blossoms in Van Buren. We're a long-term care and skilled facility. We take all sorts of insurance, including VA. So if you ever need some rehab or need some long-term care, I'd be more than happy to assist you. My number is 479-670-0073. Thank you and have a blessed day, y'all.
Good morning, almost afternoon. I hope y'all enjoy your lunch. It looks awesome. I'm getting hungry myself. I'm Teresa. I'm from Van Buren Legacy. We are an independent retirement living. We are in Van Buren, Arkansas. And we also have an assisted living. And we also have an assisted living memory care. So if you know of any loved one or know of anyone that might need any help with assistance, and or if you're getting tired of maintaining your home and you're getting tired of finding somebody to mow the grass or fix the air conditioner or the heater, clean the house, come see us. We'll do it all for you. We cook, we clean, and we do your laundry. We will spoil you. And we have activities and entertainment come in. And I'm going to get this group today to try to come in and sing for us too. So they're awesome. That was really good. My number is 479-262-6466. Thank you, and y'all have a great day.
Good morning, my name is Christina Lacey, and I'm working for River Primary Care Services. We have a medical clinic here in Bonanza, South 45. We have a medical clinic and also pharmacy. We take all insurances except Solo Care. But we take Medicare, we take VA insurance, we take supplement, we take Spanish, and also we have a pharmacy beside the clinic. You don't have to be our patient to use our pharmacy. So that if you wanted to check it out the pharmacy, and you can go in and you can, they will take care of you. And Bonanza Wellness Center, South 45 in Bonanza. Thank you.
Hello, my name is Margie Carvin. I'm a local insurance advisor. I gave you guys a little letter. Sorry if you can hear me. I did put a letter in your bags for you guys. So if you have any questions about your insurance, I do Medicare, supplements, standalone prescription drug plans. If you just have a question about your insurance, I can help you with that with no fee. Or if you're needing to apply, I can also help you out with no fee. And my number's in the bag, but it's also 479-388-4155. Thank you.
Bags, but I have some of these.
Hi, I'm Tia Coy. This is Lisa over. We are from Mercy Press with assisted living in Garland, Arkansas. We have assisted living along with memory care. Have any questions? Our number is 479-478-3000.
Okay, so here comes the fun part. Who's ready for door prizes? Anybody? Anybody feeling lucky? Yeah? Okay, so I'm going to have my lovely assistant over here. All right, this is Kathy. Okay, so how we do this is we actually just pick numbers. So what's that bottom number? 67. Who can holler a number 1 through 67? First one I hear. 25. Tom Harold. Is Tom Harold here? Oh, there we go. All right, if we can get him a door prize back there in the back. Mr. Harold, can you hold up your hand, please? There we go. All right, number 1 through 65.
26.
Whoa, okay. I think I heard 2 first. 2? Doug Lovely. Doug? Oh, look, he's back there. It's the winning. That's the winning section back there. Look at that. Okay. All right, give me another number.
3.
We got 3. Greg Wright. Greg, is Greg in the building? Greg Wright, Phil? Huh? George. George Wrightfield. Is he here? Oh, he was waving his hat back there. Good deal. We still got plenty of prizes, right, ladies? Okay. All right, let's have another number. Number 6. Is it Claudine?
Oh, is that me?
It's a scribble. Claudine. Yep, number 6. Okay, we need some big numbers. Somebody throw a big number out there. 37.
I don't think she got a prize, I'm sorry.
Gary Bobbitt. Gary Bobbitt. Is he here? Oh, you are a winner, sir, of some Cadbury eggs. There you go.
That's nice.
Okay, so I need 2 more numbers. What's another one? A high number.
40.
52?
Yeah, right.
Oh, that's Kathy. We're not going to give her your prize. Let's go. Let's go to another number. What was it? 54?
64.
64. Jerry. Oh, yeah. Jerry Chapman. Jerry. Oh, yep. All right.
That's the winning
There's
table.
Black Hat. Is that all of your prizes, ladies? One more. One more number. One more number.
I got 2. There's 2 more.
60?
60.
16. 60?
Yes, 60.
60. Mary Leonard? 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 Listen, I went to Alma High School. We did not learn Christian very well, so I apologize.
We got 2.
All right, is that it?
Okay, yeah, there's
Oh,
2
we got
more.
2 more. 3 more. Look, we still got prizes. Okay, what's another number? 63? Oh, we already called 63. Oh, here?
47?
45. Lisa Holbrook? Yep, that's one of our members. Another number. Let's get one from over here.
15.
25.
Didn't that we do that one? No, I don't know.
Tom Harold. Tom Harold?
They already did
Is
that
he
one.
here? Oh, we already called it, I think, maybe, or no? Did he get a prize?
Yes.
Okay, let's start. Can we have another number from the middle? 35. Larry Hargrave. Larry? Oh, here. All right. Well, once again, we just want to thank you genuinely for your time. And what? Do we have one more? Oh, we have one more. Okay, one more. So can we have one more number? Let's do over here in the back. Can y'all pick a number? 15? 15. 50. They say 50.
I know, right?
Is it, ask this lovely lady, is it Wilma?
What's the last name? Can you see it?
This is why it's important to write your name clearly so people can read it. My husband would not want a prize today because he goes, whoop. But I get it.
Do number 4.
Yeah, do a low
Just do number 4.
Okay, I think we're going to have to move on with another number. I'm so sorry. But we're going to do number 4. It said, where did you get that one? Rachel Fredrickson. Rachel in the kitchen. Thank you, Rachel. All right. Well, once again, thank you for your time. Truly keep that book on hand. If you guys have any questions, call those numbers because those are true numbers you're going to get to. You're going to get human beings. You're not going to get an automated system. But if you have questions, let us know. And if I can't help you or if my friends can't help you here, we will find you the help that you need. And we hope you'll have a very blessed day and enjoy your lunch. Thank you.
Congratulations.
So is there no one in your age? Have a great day.